Hi, this is group number two's project on colorectal cancer with Ramucirumab, also known by its brand name of Cyramza. First, we will discuss the basic cancer research. Colon cancer is also known as colorectal cancer, as the rectum also tends to be affected, typically originating in the epithelial tissue of the colon and rectum. More specifically, most colon cancers tend to arise from glandular epithelium, which is a type of epithelial tissue that is found on the internal side of organs that secrete mucus, and they help to expel digestive material through and out of the body. In most cases, the glandular epithelium of the colon is affected. The cell type of origin in colon cancer is epithelial cells, particularly the glandular epithelial cells. The most common tumor type is adenocarcinoma. These tumors develop in the cells lining the inner colon and spread throughout the body. Adenocarcinomas account for about 90 to 95% of colon cancer cases. The polyps tend to begin as benign, meaning they're not cancerous, and over time they grow into cancerous tumors. There are five subtypes of colon cancer, and these include CMS 1, 2, 3, 4, and mixed. The two most common types are CMS 2 and 4. CMS 2 is canonical, and CMS 4 is mesenchymal. Canonical refers to the WNT signaling pathway and MYC activation. This subtype tends to have a favorable prognosis and has epithelial characteristics, whereas mesenchymal refers to the stromal infiltration and angiogenesis, and this subtype tends to have a poorer prognosis and has mesenchymal characteristics. The most common tumor suppressor gene in colon cancer is the adenomatosis polyposis coli gene, also known as APC. This gene is meant to help keep cell growth and division in control, as well as maintain normal tissue architecture in the colon. Colon cancer, when the APC gene is mutated, can lead to activation of the WNT pathway, and this is due to beta-catenin accumulating due to the beta-catenin not being degraded. And it causes the WNT pathway to activate, which leads to excessive cell growth and division to occur. Due to APC mutations, there's an increased risk of polyps forming because of the uncontrolled cell growth, and it leads to a buildup of tissue, which forms a polyp, which, like I mentioned earlier, these have the possibility of becoming cancerous. The suppression of the APC gene function is what leads to cancer metastasis. Some consequences of mutation include the loss of function, genomic instability due to chromosomal instability and defects in DNA repair mechanisms, as well as impaired cell cycle and defective apoptosis, as having APC mutated can helps cells to survive and grow. I'm going to be discussing the most important molecular components of this WNT beta-catenin pathway. Beta-catenin serves as a transcription co-activator, which forms a complex with APC to degrade beta-catenin when mutated. Beta-catenin is no longer degraded, and it causes the loss of APC and the accumulation of beta-catenin in the nucleus. APC is a tumor suppressor gene that is a key component in regulating the degradation of beta-catenin, and when this is not done so correctly, the tumor growth occurs. Axin is a scaffolding protein, and it forms a degradation complex along with APC and GSK3 beta to regulate the beta-catenin. When this process is interrupted, beta-catenin accumulates, and this is just part of the process. There's a number of other components in this pathway, including cyclin D1, MYC, GSK3 beta, and the image here depicts this pathway. Our targeted therapy that we will be discussing is Ramucirumab, which targets the proto-oncogene VEGFR2, and this stands for vascular endothelial growth factor receptor 2. This occurs because in colon cancer, tumors often overexpress VEGF-A, which is a growth factor that activates angiogenesis by binding with the primary receptor. And in this case, VEGFR2 binds on the endothelial cells of blood vessels. And when VEGF-A binds to VEGFR2, angiogenesis occurs. This brings more blood flow and nourishment to the tumor to help it grow and metastasize. The main hallmark here that is affected by Ramucirumab targeting VEGFR2 is inducing angiogenesis. This is because tumors need angiogenesis to occur to supply the tumor with enough nutrition, oxygen, blood vessels to grow, but Ramucirumab blocks the VEGFR2, thus inhibiting angiogenesis from occurring and starving the tumor of its nourishment. Therefore, the colon cancer would not be able to grow. VEGFR2 is responsible for promoting angiogenesis and helps facilitate tumor growth. In response to the secretion of VEGF-A as tumors grow, mutations are rare in colon cancer regarding VEGFR2. This is not typically how colon cancer is spread. However, aberrant expression does occur. VEGF-A overexpression in colon cancer is common, especially in hypoxic tumor regions, and this overexpression leads to hyperactivation of VEGFR2, inducing angiogenesis, tumor growth, and metastasis. And in VEGFR2 overexpression, the endothelial cells surrounding these tumors is where the VEGFR2 is overexpressed, and this amplifies the angiogenic response to VEGF-A, promoting abnormal blood vessel growth, which in turn supports tumor growth. Thank you.
I'll be discussing the epidemiology portion of the colorectal cancer with Ramucirumab. The recent public health of colorectal cancer in the United States is the second leading cause of cancer, with about 107,000 incident cases, and of those, 54,000 cases were men, 52,000 cases were women. Here provided a chart of the incident mortality rates of men and women in the United States in 2008 of the colorectal cancer per 100,000 population by age group. So in the world, in 2022, colorectal cancer was considered the third most common cancer with about 1.9 million incident cases. About 1 million of those cases were men and 856,000 cases were women. I provided this illustration here so that you can see where the incident and mortality rates are occurring throughout the world. Okay, and so the mortality statistics for colorectal cancer of 2022 was 904,019 deaths. And this cancer mainly attacks men more than women and can occur about 45 years of age or older. China, United States, Japan, Russia, and India are considered the five top countries that have the most colorectal cancer incident cases. And so incident cases have increased drastically since early screening was introduced. So the observational study that I found was a prospective cohort study in the United Kingdom from 2006 to 2010. There were about 475,051 participants that were men and women, and those men and women were about 40 to 69 years of age. So they did follow-ups every 24 hours via questionnaire, and in the questionnaire had asked what they had eaten. In that questionnaire, it contained if they had eaten red meats, processed meats, poultry, fish, dairy products, cheese, fruits and vegetables, and any kind of bread. So they were able to identify the outcome from follow-ups and from a biobank registry, which contained the medical records or death records of the participants. And so in this observational study, they used their dietary supplement as the exposure, but one of the risk factors that I wanted to focus on was red meat, and the outcome, of course, is the colorectal cancer. So the risk factor here, again, it could be red meats, processed meats, any other thing, but I'm going to mainly focus on red meats or processed meats with using the hazard ratio chart. As we can see here, it shows you how much the participant has eaten red meats, or processed meats a week, how many participants. And as we can see here, each line is over 1, indicating that the more you increase red meat or processed meat intake, the higher you are at risk for colorectal cancer. And as we can see here, the confidence interval does include 1, stating that this observational study is not statistically significant. However, how can this be a useful study? Well, for meat lovers in here, or it could be used for primordial prevention, which is a general health promotion that can be a mass education for meat lovers. Not just mainly meat lovers, but for anybody who likes to eats red meat or does have a lot of red meat in their diet. So an intervention study that I found of ramucirumab versus a placebo was a randomized controlled trial phase 3 study. This was done between 2010 to 2013. And so each group, the ramucirumab versus the placebo, both had a second line treatment with FOLFIRI. And so the participants in the study were metastatic colorectal carcinoma patients that did receive their first line therapy. Now, the first line therapy was RAISE, and there were 536 participants in each group, the treatment and the placebo. And they had started the treatment, or they started this study during or 6 months after their last dose of their first line first line therapy treatment. So this was randomized, this was double blind, and this was multi-centered. In order to, one of the things that they did to keep it randomized was that it was time to disease progression after starting the first line treatment of the participants. And the primary endpoints was overall the survival in intention to treat population, intent to treat. So the magnitude effects of the overall survival, you can see that the red is the ramucirumab with the FOLFIRI versus the placebo plus with the FOLFIRI. We can see that participants had an overall survival of 13 to 3 months versus the placebo that had 11 to 7 overall survival months. And we can see that the hazard ratio was 0.84, which is below 1, indicating that the ramucirumab treatment did have pretty much worked, pretty much increased their overall survival versus the placebo. And we can see that this magnitude effect is statistically significant because it does not include 1. And another magnitude effect that I wanted to look at was the progression-free survival between the ramucirumab versus the versus the placebo group. We can see that with the ramucirumab group had about 5 to 7 months progression-free survival versus the placebo group, which had about 4 to 5 months progression-free survival. And again, that remember that the progression-free survival is the length of time during and after treatment of disease. This means that the patient lives longer with the disease, but the disease does not get worse. And we can say with confidence that this is statistically significant because 1 is not included in the confidence interval. Now, with ramucirumab, there were side effects. Some of them I'm going to point out that had the highest risk or the highest side effects were diarrhea, fatigue, and nausea, neutropenia, thrombocytopenia, which is the loss of certain white blood cells, and bleeding and hemorrhaging and epistaxis. I will say, again, and with the risk and benefits analysis, the left is the overall survival and the right is the progression-free survival. And I really want to focus on time of disease progression of participants that had more than 6 months versus the 6 months within the ramucirumab versus the placebo group. And we can see here that the first line is below 1 and the second line here is a little bit over 1. This patients that had overall survival less than 6 months, were at a higher risk versus those that had lived more than 6 months. And on the progression-free survival, we can see that both patients who lived more than 6 months or less than 6 months, this line here was below 1, indicating that the treatment did work, that it did increase their progression-free survival. And yeah, that's pretty much it.
Hi, today I'll be presenting the clinical application of Ramucirumab, brand name Cyramza. And I'm sorry if I mess up saying those. Cyramza is a monoclonal antibody approved for metastatic colorectal cancer. It's typically used as a second line treatment for patients whose cancer progresses after chemotherapy. Cyramza targets VEGFR2. a receptor essential to angiogenesis. Angiogenesis is the process tumors use to build new blood vessels. By blocking VEGFR2, it shuts down signaling pathways like RAS and MAPK and P13K and AKT, which are crucial for tumor survival and spread. This cytostatic effect slows cancer progression rather than killing the tumor cells directly. For greater impact, it's often combined with docetaxel or fulvira, which disrupts DNA and cell division. And you can see all these different pathways here. The clinical response to Cyramza depends heavily on tumor location. You can see on these images that on the image, left-sided colorectal tumors generally respond better to targeted therapies. We'll just targeted therapies. While right-sided tumors are more aggressive and resistant, partially due to genetic differences like BRAF and MSIH mutations. Cyramza is administered after progression on a platinum-based chemotherapy. And while it offers a survival benefit, it's very modest, you could say. This highlights how resistance impacts long-term outcomes, with tumors often activating alternate pathways like FGFR or mutating VEGFR2 itself. Once cancer has metastasized, typically to liver, lungs, or peritoneum, the 5-year survival rate drops below 15%, which are very low, which is very low. VEGFR2 was chosen as its target because it plays a key role in tumor angiogenesis, but is less active in normal tissues. The rationale for targeting VEGFR2 is grounded in its critical role in pathological blood vessel growth, which supports tumor survival. Cyramza is highly specific. It doesn't block other VEGF receptors, but some side effects still occur because VEGFR2 is also found in healthy vessels. Some side effects and why they happen is first high blood pressure due to reduced blood vessel relaxation, bleeding and delayed wound healing from impaired vessel repair, protein in the urine from effects on kidney blood vessels. Because of its narrow therapeutic index, precise dosing is crucial. Too high of a dose increases in toxicity. Too low of a dose may reduce the benefit of the therapy. In summary, Cyramza offers a targeted therapeutic option for patients with metastatic colorectal cancer, especially those with left-sided tumors or high VEGF expression. Although resistance remains a challenge, Ramucirumab contributes to disease control in cases where standard therapies, chemotherapy, have failed. Thank you.